So today I'm actually going to teach you how to help fix your low back pain. In particular, if you're noticing it right here on these bony protuberances right here, we call your PSISs. And I want to show you some ideas today on how you can help yourself and how you can help move through that to help live at your best. Hi, I'm Dr. Matt Bradbury, family corrective chiropractor here in Georgetown, Ontario, Canada. This is our practice, One Life Family Chiropractic. Today I want to talk about low back pain, in particularly if you have some weak muscles in that surrounding area, how you can test and how you can actually help strengthen those muscles, and some things you can use to help work through it to be at your best and move at your best. Of course, if you're just tuning in and you're enjoying our content, please take a moment to like. And if you're enjoying it that much, please consider subscribing as well. I'd love to have you getting our updates and sharing the message of good health, good function, and good spine and nervous system health. So I actually want to talk today about some small muscles and some bigger muscles. And you're actually going to see, this is the posterior look, or the back view of your spine, your low back. And as I was saying, if you notice that discomfort over here, atop of these bony protuberances we call your PSISs. What I want you to think about is your glute max, one of your prime movers to keep you upright, powerful muscle. And then deeper to that, what I want you to think about is your glute medius. And then there's your glute minimus as well. But today we're going to talk in particular about your glute medius, how to test for it. And a lot of times if you create more strength in that area, you're going to be that much more resilient. And if you're suffering from low back pain right now, or that pain into the buttocks, this may be an area that is implicated. So I want to teach you how you can test that and how you can actually strengthen it, and some things you can put in place every single day to help live at your best. So you'll see here on our spine view, just so we take a little more global picture of everything, we're talking about through here, right? Your posterior view, this is your buttocks. We got your glute max, which crosses over your SI joint here, helps keep you upright, moving. And then some of those smaller muscles that need to be fine-tuned sometimes, your glute medius coming through here. And a lot of times, I'm going to show you actually how to test for it, but I want you to consider also, this is going to be important, how you move this muscle, but what is it controlled by? The nerves, your nervous system, which starts up here. As your family corrective chiropractor, many a times people may be noticing it down here, but they're compensating above and below the area where they may be noticing it, and they're not even aware of those compensations. And that's why it's so important. What do we test for? Well, we look for whether or not your spine's shifted and whether or not the nerves are irritated. And those nerves control your muscles, your organs, help with your healing, and help your body work at its best. So you can start thinking that in order to have great function, you have to have a healthy spine and nervous system, which is going to help you heal and live full out and function that much better. So one of the ways you can actually test to see if this muscle is weak is, what I want you to do is try your march. And just, if you're in the gym or you're just standing there right now watching this, make sure first of all, if you're watching this, there's no seated downtime. Make sure you're standing up, grab your phone right now, just like this, and hold it just like this so that you can watch in one of the best ergonomic positions available to you right now. So you're not craning your head forward, because up here is going to be connected to down here as well. So when you're here, what I want you to actually try is just stand up in the marching position, and I want you to see, maybe you're suffering right now from that low back pain, and I want you to see if you have some shift. And what you're looking for is some slight shift over through here. This is one easy way to test if that muscle is weaker than it should be. Of course, if you've reached your limit and you're getting pain, you may find this beneficial as well if you work on some of these muscles and test or use what I'm going to show you next. But what you're going to do is stand just like this and take note to see if you shift off to the side. If you shift off, and I'm standing my left foot down to the left side, that's going to be the left side that I'm going to start by targeting next. So I'm actually going to be working lying in the side lying position on this table. And what you're going to do, your contact, you're going to take your hand like this if it's on your left side, and I'm going to find that bony protuberance, and I'm going to fall just down below it. And I'm actually going to traction. I'm actually going to put some pressure towards my spine, just like this. So here I found the bony protuberance landmark. I've down, and I'm actually going to put some pressure into it this way. So I'm driving this way. And what I'm going to do is, when I lay on my side, I'm going to go through a range of motion. So you'll see here, what I'm going to do is actually turn my foot in, and I'm going to drop my leg off of the table, and I'm in the bent position of the knee. And now I'm actually going to come up and I'm going to turn my leg out. So I'm going to go through a range of motion just like this, 5 to 7 times. And I can come down like this, pause, breathe, and then come up just like this. And I'm trying to extend my leg as hard as I can. Now when I come up here, I can turn my leg out, maintaining that contact with my thumb on the top of my buttocks, breathing. And you may find it's really sensitive at the end. So when I'm here, I may find myself really stiff through here and tender at the end range. And remember, my toes are turned in a bit, some internal rotation of that hip. And then I'm reaching up just like this. Now, one other neat technique after you've done your 5 to 7 passes is actually just get in there, breathe, and you almost think about getting right to the end range and holding it for max contraction just like this. And what I'm doing now is I got my toes pointed up at the ceiling and I'm contracting it. I'm just trying to loosen it up, because if that muscle's fatigued and stiff and tight, you want to get it to relax. So what I'm going to do when I bring it up like that, I'm actually going to hold. I can hold anywhere from 15 to 30 seconds, breathe. And if you want to get maximal contraction, put that trigger point down and turn that toe up to the sky and straighten that leg and try to reach back with your foot. So remember there, you'll notice with this one, what I'm doing, with this one, I'm actually not starting with the lacrosse ball. So I'm starting on a little less intense of a scale, and I'm starting by doing some soft tissue through a range of motion, teaching you how to work on yourself, and also teaching you how to get that end range and cause that muscle to relax so it's not gripping tight and more or less not working the way it should be working. Now the next exercise, what I want you to do is actually bring your arm up the wall like this. And if you're trying to strengthen your left side, my left leg is the one that's further away from the wall. And all you're going to do is bring your knee up like this, let yourself fall out, and then pick yourself up. Now, after you've done that, I'm actually going to share with you how you can strengthen it. So I want you to start just like this on your side. And what you're going to do is, all I want you to do is think, this one's just the clamshell. And think all those small, tiny hip muscles, all you're doing is opening your legs like this, pausing, and then back down. So I'm going to lay right on my side. And what I'm going to do is open up just like this, pause. And when you're doing this one's going to be done in the range of 10 to 15 reps. If you're just starting, start with less reps. 2 to 3 sets, 10 to 15 reps. Start with 10 reps, 3 sets. And just because it's your left side bothering you, I still want you to roll over and work on your other side as well, your right side, to help keep those muscles strong and thriving. Up, fall out, and pick yourself up. With the thought process being you're really putting your thought, your energy to your hip, squeeze up, straighten out, and let it drop down. Again, with this one, you can work in the 10 to 15 rep range. I really like this one because it's loaded, you're upright, takes a little more effort to coordinate, but essentially if you're working on the left side, the challenge side, I still want you to go back and work on the side where you may not be feeling it, or you may not have noticed that weakness, just so you create that structural balance. And again, keep those muscles as strong and healthy as possible. And for my final one, what I want to show you is actually just grabbing the band. This is a great one you can do at the gym. I mean, you can do all these at the gym, but essentially this one is great. You can take your warm-up band and just step into it like this. And now the emphasis when you're doing this, the emphasis is actually hiking the hip up, and I turn my toes from straight 10 to 15 degrees outward, and I just walk like this. And the whole time I'm trying to spread my feet apart, so I'm keeping the pressure outward, and I'm keeping this area, I'm hiking my hip and thinking about contracting and using these muscles through here to help cue and retrain essentially the way you coordinate how to move and strengthen your glute medius muscle, which may be implicated if you're suffering right now from low back pain. Now, as you finish up, remember, this is going to take some work. Just like starting any new exercise regimen, give yourself weeks, months to help retrain the way you move. But you may even notice a difference within a couple of sessions of helping to loosen up your glute med and re-strengthen it. But just because necessarily it starts to feel better, I still want you to focus on strengthening it, because that adaptation takes a few months as you regain your strength and improve the way you move. And as with anything, in terms of natural health, Consistency is going to be key, in particular, getting you back on track with your health. And as I mentioned before, consider the health of your spine and nervous system. Yes, you may be retraining those big joints and how you move, but a lot of that fine tuning comes with a proper biostructural assessment and assessing any corrections that need to be made with your family corrective chiropractor. So consider the health of your spine and nervous system, consider the whole system when it comes to your health and healing and getting back on track. So hope you enjoyed today. It was a lot of fun sharing with you some of these simple things that you can do for yourself. And of course, as I've shared in the past, I got a big mission in terms of helping people understand their health, which I think is so important in terms of small things they can do every day when it comes to they got to have more function for more health, and they got to have great spine and nervous system health to live at their best, keep up with their kids, keep up with their grandkids, and play full out. So if you consider clicking share the message so I can help spread the word. I can't do it alone. And if you enjoyed this, consider subscribing so that you can get more great content and stay up to date with your spinal hygiene and your spinal health. Anyways, I'll talk to you soon. Remember, you're far stronger, more resilient, and resourceful than you necessarily have been led to believe. Bye for now.